I'm Dr. Christy Smith, and we're going to talk about the rotator cuff, things you might be doing to injure it, and things you can do to help yourself stop injuring it. So this is the collarbone right here. This is basically the underside of your shoulder blade, so kind of underneath through here, because this between the actual back of the blade. Right here you'll have the ribs, and then this is your arm bone, your humerus out here. So something I see chronically with people is this sort of posture, and that can actually be putting a lot of stress through your rotator cuff muscle. Injuries in sports usually come from throwing with too much force, using the wrong muscles. Injuries from chronic sitting at the computer come because you're using the muscles improperly. So a couple of these muscles should actually just be fired really for external rotation, rotating your arm back. Some of them should be used for internal rotation, and one of them is used for kind of a lifting of the arm. What happens is when you're sitting like this at the computer, you're using all of these muscles that should be relaxed while you're sitting or standing upright to help stabilize the shoulder and all the weight of your arms all day long. Even if you're sitting in close to your desk, if you're using some sort of hunched posture, you can be turning those muscles on and using them when they don't need to be. So really quickly, you've got two on the back here that help with external rotation, okay, and that is the infraspinatus, and this is the teres minor. Where it turns white, that's a tendon that goes from muscle, tendon, into the arm bone. Up above, we've got supraspinatus, and that goes from muscle across here, underneath the bone, and the ligaments there to attach out front here. And then underside, we've got subscapularis, which is underneath and through here, and that actually helps with rotating in. The supraspinatus helps with lifting the arm and stabilizing and protecting that shoulder joint. The problem with that is that these muscles on the back here and the one to help lift become fired a lot when you're trying to just sit in this position. Over time, that can create enough of a strain to either cause a tendinitis out here, anywhere through this area, or you might also have an actual tear. A shoulder surgeon I spoke with told me he thought that about 60% of the population actually has a tear to one of these muscles and doesn't realize it. So it may show up on an MRI if you're having shoulder pain, and it may not be the actual problem. So I recommend you get several opinions from the MRI, and also testing when they check to see what is painful with you and what motions hurt. That's just as important as what the MRI says, because you may see something on the MRI that's a problem that's not actually causing the problem, and you don't want to get surgery on something that isn't causing the problem because you won't get any results. The two most important things you can do, basically watch your posture. Keep a really good posture of what you're doing, and when you are getting pain into the shoulder, especially if it's like a searing kind of newer pain, you really want to ice it. I want to promote ice over heat, just because most of the time this area it's going to be a swelling kind of reaction, and you want to try to help calm that. And if you continue to have pain after a few days, you really need to get it checked out. Go and see someone who is familiar with doing extremity work, which is what you would call this, for the shoulder joint.